welcome to this sixth webinar in a series today, which is all about evolving public health communications. My name is Andrew Hadfield, and I'm going to be chairing the session today on behalf of Can Digital. So on to today's session, really excited to hear Russell Cartwright, who will be the first speaker. He's a behaviour change communications consultant working directly in the NHS. So over to you, Russell.
Welcome everybody. As Andrew mentioned, I work in the NHS. I've worked in the NHS for almost 25 years now in communications and engagement. And the last 5 years or so, I've really kind of specialised in public health behaviour change campaigns, running a number of quite impactful campaigns and winning several awards along the way. And I now split my time actually with a part-time in-house role and part-time supporting and training as a consultant other in-house teams to run behaviour change campaigns. I've also, with the support of Can Digital, set up a public health communications hub where we run lots of free webinars and kind of solve problems together, that sort of thing. And so please, if you or any of your colleagues are interested in joining that, please do join up. And I think Danielle is putting the link in the chat for me now. So some of the things I'm going to cover today. I'm going to cover briefly kind of using behavioural science for your campaigns. I'm going to draw on my experience doing this and also looking at what I've heard through the Public Health Communications Hub, what I've seen from other areas, and we'll be looking at things that work, things that don't work, some of those things. Looking also beyond communications and marketing, what else influences whether people take your target behaviour, choosing some of the right channels, and really importantly, measuring, benchmarking, refining, and kind of optimizing what you do. And as part of that, I'm going to talk about something we've done in South East London around optimizing a landing page. So why behavioural science? Well, I really like this quote from Dan Bennett at Ogilvy, and it's really just about giving us, as the quote says, giving us the insight that we need to really try and unlock the impact and the behaviour that we're trying to get people to do. So there's a lot of people who claim, a lot of agencies, big agencies and things like that, who claim to do behavioural science, and some of them do it really well. Others, it's just one of these buzzwords that gets pushed around, within communications and PR over time. But one of my points is, and something that I've proven in my work in-house, is that it doesn't have to be rocket science. It is something that you can have a go at yourself, or you can bring in someone like me for a short period of time to help your team, do this themselves in-house. You don't need to go out to a big agency and spend, a lot doing your insight work. But the real key difference between this and other campaigns you might have done is that there's a real emphasis on research and insight. As I said, understanding that what drives that behaviour, or what barriers are in the way of people taking your target behaviour. And it's all about using the evidence, using the science and using the evidence to design your messaging and your interventions, which can be communications channels or other things, based on what's worked for similar problems or similar behaviours elsewhere. And some of you have probably seen this Combi tool before. I'm not going to go through it in detail, but basically a simple way of describing it is there are three doors that need to be open for a behaviour to change. So in the blue, you've got what would be your target behaviour on the right-hand side. And the person that you want to perform the behaviour, they need to be physically and psychologically capable of performing that behaviour. They need to have the physical and the social opportunities to be able to perform that behaviour. So, for instance, if I don't know, if you're talking about somebody supporting someone else, if they're absent from that person, then that physical opportunity doesn't exist. And they need to be motivated to perform that behaviour. So it's it can be quite complex, but it can also be quite simple. And this theory is good because it's lots of people who aren't behavioural scientists have managed to get their head around it. Before I started training as a behavioural scientist, I used this a lot and managed to get my head around it. So it is, as I said, it is something you can do yourselves, and it is well worth the effort because you will see a real increase in impact if you do so. So I mentioned kind of considering some of the environmental factors, and this is true of all communications campaigns. We've all kind of promoted stuff, flu vaccines or breast screening is one that I've done, where you line everything up, you get your ads out there, and then all of a sudden the supply of the flu vaccines isn't there, or the service that you're promoting doesn't have the capacity to offer appointments, or they only offer appointments at a time that your target audience can't make, or those sorts of things. There may be other kind of external kind of social and cultural influences that stop people to performing the behaviour. It might not be a social norm. There may be cultural things are mentioned, and there may be other barriers or other antecedents that lead to that behaviour or don't lead to that behaviour. I think another good question to consider is, will communications on its own be likely to change your target behaviour, or does it need to be part of other interventions? Also, is what you're trying to do this is a really useful tool to look at. So is it easy? You've got to make it easy for people to perform your behaviour. You've got to reduce the effort from their behalf. So have a simple user experience, simple calls to action. Is it attractive? Attract their attention and frame the behaviour that you want them to do, and potentially incentivize it somehow. And I'm not talking about financially incentivize them, although that could be a way. But it's show them the benefits really. Make it social. Make it a social norm for people like me to do this thing, and make it timely. Choose the right moment. And quite often in public health, for instance, for smoking, that might be all of the time, because we often make the mistake of having a big burst of activity over a short period of time. But actually, people, you need to catch that smoker when they are giving consideration to stop smoking, or at the right time for them. So often, always on could be the right time. But it's all about really helping people bridge what we call the intention and behaviour gap, which is a big thing for public health. So I'm sick to death of seeing millions of pounds of public money wasted on public health advertising each year. And this happens due to lots of different reasons. I've summarised some of them here. It might be due to unscrupulous but also very convincing salespeople pulling the wool over our eyes, to put it bluntly. It may be that we're doing what we've always done, even if we have no idea of the impact. There are a lot of channels that are really hard to measure. It might, measurement and evaluation is really important. There might be pressure from others. We've all heard of, councillors or leaders of the council wanting to see campaigns on the backs of buses, or, wherever, when actually there isn't much impact there isn't much evidence of that impact. Also, some things change fast in digital advertising, and it is hard as a comms professional to keep up to speed with that. But I guess there is, just ask for help really with that. and it's often a combination of all of those. It could be lack of time. Often we get given resources or money to run campaigns at the last minute, and the easy option is, oh, let's just do what we always did, you know. But actually, that's not what you want. If you want to have impact, you need to think differently. So I ran a webinar on this last year, and I went with a punk theme. Really, I think what we really need to do is shake it up and try and do things a little bit differently. I mean, this is a bit of fun, but I do have got slight concerns that the more times I say this and the more times I run this ad, I'll get put on a hit list from some of the big media buying out of home agencies. But you know, hopefully not. I'm sure we'll put in place some security. So, sorry, I'm just going to go back one actually. Just either way, it's, I mean, although I'm making fun, it is a scandal, and I've also witnessed within, you know, my peers and things like that, a bit of an underlying belief, sometimes amongst people in our profession, and certainly amongst some of our leaders, that local public health campaigns don't really work. And I know that isn't the case. Using a behavioural science approach and choosing the right channels, which are measurable, we can make a massive difference to the health of our residents. So moving on, some tips. So again, a bit of fun, but avoiding ISLAGIAT, which is a great acronym, but it seemed like a good idea at the time. Now, this is a spoof, it's not genuine, but we've all seen smoking cessation campaigns featuring featuring cigarettes, you know, people smoking, etc. When that has been proven to trigger smokers who are trying to quit, and you know, when you're dealing with addictions, basically the last thing you want to be doing is triggering people. An easy mistake to make, but a common one. And so really what I'm saying is, don't go with your gut in terms of what seems like a good idea, because quite often it won't. Use the evidence, and you know, there are things like, linked to the COM-B model I mentioned, there is a behaviour change wheel, which as I said, will really tell you what is likely to work and what's worked elsewhere, in terms of messaging and in terms of interventions, for what you're trying to achieve. Yeah. So in South East London, I've been working with 6 London local authorities who've all collaborated, and we've basically gone through the behavioural science approach. So we've done COM-B, etc., and developed a campaign which has been running and is still running across the 6 boroughs. And this campaign concept was developed to use the kind of commonly understood theme of a loving relationship as a metaphor to help our audience think about their relationship with smoking. They know it's bad for them, but most of them love smoking, or the feeling of taking a drag. They've tried to leave the relationship in the past and failed, because we know most smokers have. And you know, we've kind of framed quitting smoking as effectively ending this relationship. And mix that with mix the metaphor with empathetic messaging, that we understand it's hard, but they can do it with support. It's also designed to be simplistic, attention grabbing and amusing, and highlighting for people some of the quick gains, you know, like, you know, extra money in your pocket, better teeth, skin, hair, etc. And also try to use relatable people, and with some of the ads featuring a design that's meant to replicate popular magazines. So how did it do? So the early results showed promise. There's some big numbers there, which you're probably quite familiar with when you run campaigns. Quite often we get big numbers like these back. And what typically happens is we'll have a big burst of activity and then that campaign will end. These early results did show promise, and that the stats are quite impressive. But however, when we looked at it, the cost per quit attempt, so people referring, which was our call to action, referring themselves to the Stop Smoking service, was actually quite high. So what we did then was look at what other areas were doing. So with the support of CAN, we benchmarked against 6 other counties and regions, and we could see that there was a much lower cost per quit attempt particularly in Worcestershire and Coventry and Warwickshire. And so we had a look, what are they doing differently? So a key thing that we did was we adapted our landing page. We changed the landing page to reflect more, be more like what they were doing in Coventry and Warwickshire. We felt that insisting on people giving us their phone number might be a barrier, so we gave them the option of a phone number or an email address. We also optimized our advertising. So, like I mentioned, quite often those campaigns would end after that big burst, but actually what we did is we reduced their spend right down, but took the opportunity to focus on search, where we know people are already, considering stopping smoking and likely to be more receptive, but also retargeting people who have shown an interest in our adverts previously. We know that somebody seeing an advert once and clicking on it, they may not take the call to action, but if they see it several times and we kind of follow them around the internet, then they're much more likely to take that action when they're ready, with several prompts. And that is a way of doing it in a much more cost-effective way. And as a result of those kind of modifications and refining that we've done, we've managed to reduce that cost per quit attempt by 71%, which is staggering. I'm really pleased with that. But we are looking to bring this down even further by using Meta's in-app lead generation, which is basically where instead of taking people to a separate form to fill in for their landing page, we would ask them to fill in their details on Facebook or Instagram. And that's worked really well in Worcestershire and Coventry and Warwickshire. And I've found myself doing it on Meta recently. It's simple. It remembers all your details. You don't really have to fill anything in. And the other day I was getting calls about, I'd shown a slight interest in learning how to play paddle, and next thing I know, I'm getting emails and phone calls from my local paddle court. And I think I probably, if it had taken me somewhere else, I probably wouldn't have filled that in. But because it was made really simple to me, I did that. So I can see why that does make things very simple for people. There are some, GDPR issues you need to work your way through with that, which is why at the moment it's just a hope. But I'm very hopeful that we can put that in place. So just a few takeaways from me. You always get this from me, but behavioural science is the way to do this to maximise your impact. You've got to really, really embrace it. You don't need to be scared of it. You can do it in-house, like I've said. Use evidence of where it's worked, and I'd be happy to give you some evidence for that, to make the case to do things differently. Choose your channels carefully. Don't pay through the nose for things where there's little evidence of effectiveness. And I'm just going to give a bit of a case study just to illustrate this point. I won't name names, but I took a call a few months ago from a really pushy and convincing salesperson. I was contacted out of the blue on my personal mobile, which they'd taken from LinkedIn. Despite me saying I was on leave, he continued and went with the sales call. Following that, he sent me a very, very glossy proposal outlining how the agency can support us to run what he called hyper-local targeting. Beautiful slide deck with video integrated, highlighting all their big brand customers. Lots of jargon, but it looked and sounded really convincing. All that he was trying to sell me was out-of-home, print or broadcast. And he added into that attempts to build rapport. He was, mentioning people he knew or he was linked to that I knew or I'd worked with. He was praising some of our previous work. So we'd done a little bit of research and was trying to use that. So I went back to him and questioned how out-of-home is hyper-local targeting and what evidence they have of impact. And people taking, and by impact, I'm classing people taking action after seeing something. He came back with a long list of expensive activities carried out for NHS clients, but no outcomes. So I went back again and asked for outcomes data, and he wasn't able to supply. There was lots of meaningless stats as that I see, really, like footfall and eyeballs on adverts. So I went back again, and he explained that basically hyperlocal means putting something in a certain geographical area, which, you know, we can do much better than that. He mentioned QR codes, but couldn't give me any data to see what was done. And then he brought up digital poverty, which is a very valid point. But recently, the ONS data has shown 95% of the population are online, and one of the campaigns that he showed me was for the NHS app. And there's very little value in promoting the NHS app to people who are digitally excluded. So those campaign activities that he was showing would have cost tens of thousands of pounds, and that money would have, for people who are digitally excluded, would have been much better spent having someone knock on their doors. That's hyper-local targeting, plus obviously the digital elements. And it really took a long time to shake him off. He was trying to set up meetings with his chief exec, and like I say, he was very, very convincing. And if I hadn't have known a lot of what I knew, I might have been sucked in. So yeah, I think choose your channels carefully. Don't just go with the easy option or the most convincing people that you come across. Ask questions. Ask for real impact, real outcomes. And question that and ask to see how it worked and what difference it really made, and like we did with the smoking campaign, measure it, benchmark, refine, optimize as you go, and you that way you'll be able to really have most impact. So that's the end of my slides.
Brilliant. Thank you, Russell, and thanks for sharing your contact details on that final slide. Can see quite a bit of engagement already on the comments. Great to hear some top tips from Catriona in terms of how you actually can handle some of those kind of requests and using insight to sort of push back from that. But I certainly know from my previous experience that, yeah, sometimes you do get quite a senior officer or member suggesting quite strongly some tactics that actually we know from a comms perspective don't work or haven't worked before. And I'm sure we've equally had similar kind of sales approaches with all kinds of different techniques. I'm going to move us on to our second speaker, but please do keep coming forward with both your questions, comments, and also your own perspectives. We will definitely have some opportunity for questions shortly, but next up, we've got JP Danon, who's the Collaboration Director for CAN. He's going to follow up a little bit more about how you can use search and remarketing in public health campaigns. So over to you, JP.
Thank you, Andrew, and thank you, Russell, for that. Some points that hopefully I'll be able to illuminate a little bit more on. For those that don't know, I work as the Collaboration Director at CAN, and we've run thousands of campaigns actually for public sector, and wanted to share some of the things we've learnt with you. But we believe that transforming how you buy paid media and what you choose to focus on can have massive impact on the health of the populations you serve. I just wanted to quickly go through a bit on how the population you serve consumes media. And yes, it's Facebook and Meta and a bit of Google, but it's also many, many other channels and many other sources of influence that we need to consider. We can quite easily see populations of any given area against the channels they're most likely to use. And it's really important to be able to advise and understand where people are and what they're consuming. Also, as people consume information online, they generate data, interest, intent, and you can weave other data sets that help you build programs that enable you to target advertising, right place, right time, right audience. And this is transformational because it enables you to reduce wastage dramatically. Rather than the spray and pray approaches that sometimes we can resort to, you can really zoom in on, if someone exhibits these things online, then show them these multiple messages. And this is the transformational, the revolutionary thing that's happened in our industry. And it enables us to improve what we do considerably, to make sure that we're not wasting and we're delivering high frequency to the people that need to interact with us. So we've got about 200 hours of online consumption per month to target, to reach, and thousands of sites and platforms being used every month. The challenge with that is that there's a lot of complexity, there's a lot of different influences, and there's a lot of, should we say, suboptimal information out there, particularly around the subject of health. And so how do you choose when is the right time to intervene? Well, one of the things that really cuts through a lot of this is search advertising, or as we call it, paid search. And that is really adverts being placed next to search results on Google and Bing. There are other search platforms, there's TikTok search and things like that. But in the UK, across those two platforms, there are 10 million health-related searches every single day. And if you start typing in search terms or entering search terms around, for example, diabetes, there's a lot of information. Some would argue too much information, and that can lead to maybe people not taking action or going down the wrong paths. If you look at things related to mental health, around depression, there are all sorts of strange products on place. Maybe the efficacy of these products is not high, but again, places for people to be taken off to other places. And what paid search lets the public sector do is to intercept that intent. Here we have a council intercepting, searching for payday loans and bringing them to a cost of living hub to interact with, make sure that people are getting all the financial and support that they can possibly get. And so it's a brilliant opportunity to intercept some of those suboptimal interventions and win and bring them through to what are the optimal interventions. And this is all happening for pennies or pounds, rather than organisations dealing with the cost of late intervention, which we all know can escalate into the tens or hundreds of thousands of pounds quite quickly. So how do we understand this space and understand where and what to target? Well, the wonderful thing about search, paid search media, is that you can start to look at historic search. So you can see in your area what people have been typing in, and also, really importantly, what they haven't been typing in over the past 3 years. And this is really useful for helping us understand, are there any seasonal variances? What isn't on people's minds? What is on people's minds? What's driven public consideration of certain subjects? And then we can start to identify, for example, positive health intent. So could that be people wanting to lose a bit of weight, move a little bit more? And we can then start to anchor campaigns onto that positive health intent as people search online. So if, for example, we take smoking cessation, people looking at smoking alternatives, we can take a search result for nicotine patches and intercept that with a paid ad that takes people to a landing page, as Russell alluded to earlier on. We can also create user experiences for people who are friends or families of smokers and engage them in supporting their family member down the path to being smoke-free. And that's where the second part to this. We found people at the right time. We've brought them through to a really simple user experience, but most people will land and not take any action. If you are searching for a certain thing online, what you can sometimes see is that thing then starts appearing everywhere. And that's this re-messaging idea, but we want to apply it to public sector contexts. So, for example, if people visit your council school term dates information, we can assume that maybe they have caring responsibilities for a child, and we could then put maybe MMR or HPV messaging in front of them. If you're at a combined authority with your travel information, we can target people who are demonstrating intent to cycle, intent to do active travel, or even we can target people who are paying congestion charges and maybe encourage them to take an active travel approach. So that remarketing based on the data built in your estate is really, really important, as powerful, if not more powerful, than search advertising. But it's absolutely essential, as Russell was alluding to, that we demonstrate impact. And so being able to demonstrate in real time the connection between the search, the remarketing, the prospecting that you're doing across all the channels your residents are using, and the correlation of that with some sort of outcome, a sign up for a service, a pledge or commitment to take action, is essential. And if you don't have this graph internally or from your agency, you can't do the job of cutting out the stuff that isn't working. This graph also helps you diffuse requests for some of those channels which we may, if we're honest with ourselves, feel that just don't do anything. But the most exciting thing about this is that over time, we can see that the cost per interaction is going down. So starting at that inefficient phase, that inefficient sort of awareness phase, and improving efficiency, remarketing people, nudging them through, we can prove that cost per, in this case, quit attempts, goes down over time. You can see there as well the council using ads in their emails to nudge behaviour and nudge those quit attempts along. So if you don't have this graph, you can't do the job. Post-campaign evaluation is, for a few years ago, real-time in-campaign evaluation optimization is where we're achieving most of the efficiencies on this. And so some really useful questions to ask, and also some really useful questions to diffuse maybe some of those salespeople or some of those requests for inefficient media. What percentage of our target audience will see this campaign on your channels every week? How many times will they see these adverts? Because you can't just deliver the advert once or the message once. You've got to deliver lots of messages, lots of times to that target audience. How many people take action or took action as a result of using that channel? And what was the cost per outcome for that channel or for that piece of activity? And if you're not able to answer these questions, you probably shouldn't spend any money on it. And this is a really neat way of diffusing requests, but also these are the questions that help you optimize and refine over time. Hopefully these will again help you diffuse requests too. But when we're thinking about bus advertising and so on, we're not against it in principle, we're just a bit against paying for it versus other things. When we do measure campaigns and measure out-of-home radio, above-the-line activity, the only non-digital activity that really moves the dial is direct mail, targeted direct mail. So when you have the digital divide challenge, direct mail is the key to sorting that out, and mapping where your digitally divided households are is essential to doing that, and something we recommend for all priority campaigns. But where we've measured, we've been able to see the cost per outcome from these channels. And we've seen that, using search and remarketing, we've been able to get cost per lands down to 29 pence, whereas cost per lands from all other paid combined are £81. that's a factor of 277 times. There are very few instances in life where you can improve performance by a factor of 277. Another way of explaining it to people is it's like taking your 45-minute commute and condensing that into a 9-second beaming from office to home. We're not against out of home, all of these channels at all, but we're pro them being used for free. Councils are the biggest media owners. They have vast physical and digital estates. They can be used for free to do all these sort of things. But if you divert paid media spend towards them, you're going to get a 200+ reduction in performance for the overall campaign. So your optimal amplification mix, it's not for every single time, but if you're using your own estate, audience building and delivering above the line messaging, plus targeted direct mail, plus the Google infrastructure, the Meta infrastructure and the Snapchat infrastructure, there isn't really anyone you can't reach or won't reach, and then you can achieve reach, frequency and lower or reduced cost per outcome. And just to leave you with some principles which you can borrow or ignore as much as you like, but we believe that with public health, all communication should be inclusive, and that's inclusive not just in content, where you have humans telling stories, you have the mixture of the physical and the digital, but it's also about being inclusive and making sure you reach everybody. What proportion of your campaigns don't reach 90% of the target audience? That is a huge barrier to inclusivity, and it's very important that we reduce waste and increase investment in the channels that reach people and reach them frequently. We also believe that communications is an accelerator of savings. It's not a frippery, it's not an expense, it's not something you do only when you have money. It is about investing in communications to accelerate savings. And so communications campaigns and good communications teams are able to demonstrate you got £9 for every pound, £9 back for every pound you gave us. And they also help organisations save by stopping them buying things that don't work. So use of the media state, use of effective paid, and then reducing cost per outcome in real time. All the time saving money. Communications is an investment in accelerating savings. And of course, then doing nothing without data. You can't do the two above if you aren't measuring the number of people reached in the target audience, how people are engaging, what actions they've taken, and then the savings per pound spent. And so by applying these principles, along with the frameworks that Russell talked about, we can easily move people away from using paid channels that don't work and only a little bit of the stuff that does work towards this. And if we do this, this will be the most transformational thing that we do as professionals. So if you want a resident channels report for your area, or free search insight around any topic in the counties or the combined authority regions that you use, please drop either me or Matt Kilpatrick an email, and we're more than happy to have a conversation and put those reports together for you. So that would be the last 3 years of search terms in your area around a certain theme, and also a mapping of the channels your residents are using against the population. So hopefully that was useful. I'll hand back to you, Andrew.
Brilliant, thanks, JP. Really interesting sort of presentation. Already got a couple of further questions, which I'll come back to in a second, JP, from Catriona, in terms of how people can actually use or find that data on searches, and whether that approach for remarketing still works if people haven't accepted cookies. So grateful, JP, if you've got a view on either of those questions, but also want to encourage other people to come forward with their experiences or questions. Over to you, JP.
Thank you. Yes, and hi, Katrina. that data on search, we have a tool at our end which you can send us the sorts of areas you want to search for, and we can then input those in. I'll just show you an example. So this is the tool that we use, and it basically runs cached queries from Google search. So we're looking here at immunisation searches across West Yorkshire over the past 3 years, and then we can look at all sorts of different data sets, and this helps you plan campaigns so that you know what's on people's minds. Do you have another question, Katrina?
I do, and it's the same thing as the question about remarketing. It's to do with cookies. We're wrestling with cookies at the moment. If people don't accept cookies, because we've just split in the comms team, we're sort of doing half on campaigns, half on news and content. So there's a bit more focus on campaigns at the moment. And it's wrestling with the idea of cookies and how much data you can gather if people don't accept cookies.
So yeah, the remarketing principle doesn't just apply to cookie consent. You can remarket to people through email. You can remarket to people to lots of different ways. But in that remarketing, the cookie based side of things, if they don't accept cookies, yes, absolutely right. You can't remarket in that way to them. But there are other methods using hashed email IDs, device IDs. Platforms allow you to remarket in platform to those individuals. So there are lots of different flavors of remarketing that you can use. On the discussions that people have internally about cookies, we've been through hundreds of them in our time together. At time working with multiple different authorities, and the ICO have given us some really clear guidelines on how the public sector can do this. So using Meta is not ideal because they don't silo their data, but the Google platform, Quantcast, StackAdapt, a range of other platforms, you can remarket because they keep the data just to you. So using that for all sorts of potentially sensitive areas is legal, ethical, and allowed. And so making sure that IG are aware of the ICO regulation, and also making sure that your web team understand how to do this ethically and within the guidance of the ICO and PCR, we can certainly support on that. But particularly in public health, you're dealing with addiction, you're dealing with the intent to action gap. Remarketing is so important. Another key factor is a lot of public sector organizations kind of design the cookie consent platform to by default block everything, and that blocks Google Analytics, that blocks all sorts of things. There is no need or compulsion to do that. Okay, as long as you do collect consent, you're allowed to have the allow all as the biggest button on there, and when you do that, 90+% of visits do accept all cookies. I think the public sector is normally more worried internally than the residents and populations they serve are about this. It is, in terms of performance and avoiding waste and increasing outcomes, there is an ethical balance to some of the concerns that people have on this, and it can be done, and it can be done very, very effectively. However, if you have intransigence in your organization, that's why we build the landing pages. So plan A is we go with the landing page that has all this stuff built in. We can handle everything at our end. When the web team are happy to be in market to do this, we'll switch it to them. But for now, we'll do it here. And that's really the way that we can make sure we don't waste money because of internal wranglings with data and digital. So yes, you can probably tell we've been through this a few times, and that seems to be the best way to get to ensure that the performance isn't affected.
Thanks, JP. Russell, I want to bring you back in here. Did you want to follow up on that aspect or a different point?
It's the same thing, actually. I was just going to say there's also some value in looking at how you describe that question around cookies and consent for cookies. Quite often it's done in a very risk-averse, decided by the DPO in your organisation way that is quite scary to people. And you can frame that question differently, still ask the same question, but make it sound a lot less scary and a lot more, appealing to people. And I've seen examples where just changing that wording ever so slightly can make a lot more people accept the cookies. So that's definitely worth experimenting with as well.
Russell, I was going to just come back to you though, because I did think you were touching upon an interesting kind of example in terms of sort of people's bad habits of picking some of those bad channel choice earlier, and I think I commented on the chat around those sort of bus back adverts. But yeah, why do you think people keep on coming back to some of those channels that don't work? And are there any other kind of examples where people have either pushed back or successfully demonstrated some of those insights that I think you were talking about? And I think that smoking campaign was a brilliant example, particularly that picture of the bollards, which I can definitely think people might have thought was a good idea and might even have been suggested by someone from the public health team, or potentially a pushy salesperson who's wanting to sort of push their product. But yeah, any examples of that?
Yeah, or a well-meaning politician. Thinking about why this still happens. I think as I showed on that slide earlier, there are various reasons why, and I think it's a mixture of all of those. Often, like I said, it's time, and we get given a budget and we've got to spend it quickly, or we get given a budget linked to a certain calendar event, and we've got to put something in place quickly. So the default is, let's just put the money where we go. We've done it previously. I think also a bit of it is that people haven't seen a really good, impactful campaign that's driven people to action, and that underlying belief that they don't really work on a local level, public health campaigns, when they do, again, also, the pushy salespeople play a part, especially when they're very convincing. But also, I think it is important that measurement and evaluation, having data to be able to push back, you need to be able to show this works. This worked when we did this previously in our area, or this worked, next door. They ran this campaign in the neighbouring local authority or the other part of the country even, and they did this. And it worked, that slide JP had with the two small bubbles, that if you can show that with a real life example, that makes your case for, let's not spend our budget on bus advertising. Let's spend it on stuff that actually works and actually will reach our residents. That's what you've got to do.
So that we find that these graphs save so much time. Not all graphs are particularly useful, but getting down to one graph, which is total campaign interactions across everything you're doing with campaign outcomes by date, it takes all discussion out of it. You can share this with stakeholders. You can show them overall the campaign's working, that you know what you're doing, that the cost per outcome is going down, and it's not easy to do, but it's well worth doing. And being able to show different platforms, what's being achieved, and the switching from different platforms to the others, I think this helps people accept that it's being managed. And they then say, well, look, if you've got that information and I can see that it's working better and better, I trust you to make those decisions. Sometimes I think the well-meaning request for platforms that doesn't work is because they've seen it. They've seen someone else do it, or they've seen it somewhere else, and they think, well, if they're doing it, it must work. What you can prove with that is it might have worked for them, it doesn't work for us. However, these things are working for our population, and look at the incoming inquiries into the service. It is working. You can now move on and apply your energies to something else, because this is now working. Also, with that approach, people ask, why would we ever turn it off? And you then get to a position where you have an always on campaign, which is delivering a stream of quality outcomes at a pace the service can handle. And this is what we think the communications objective should start to become for these kinds of campaigns now, public health campaigns. What is the pace that our audience are typing in terms like this? What is the capacity of the service? Can we move people to this service and do it in a measurable way, in a low cost way, to ensure that health outcomes are being achieved at a certain pace? This remains always on, and we can see the connection between communications and outcomes. That means that we're not fighting for budget. Communications is actually a part of service or policy delivery.
Brilliant, thanks, JP, and one for both of you. Thanks, Katrina, for coming back once again. Certainly very engaged in this session. JP or Russell, would you like to just come back in terms of the final question around any testing that you've done around the back of bus adverts, and yeah, how you've been measuring the form about, you know, where people have heard about a certain campaign. JP, do you want to come in first?
Unfortunately, Katrina, on those forms, people's recollection of what made them do something is notoriously dreadful. We don't really know. We sort of passively consume a lot of advertising. So this is why attribution is a bit of a dark art. But if you have a form, you have a drop down, and people say, firstly, we can't rely on what they think made them do it. Analytics is empirical. We can see what's happening on that front. So we see what actually drives things, and that's actually what we're interested in. Also, where did you hear about something? So it's less reliable than the analytics that you have. So I would always recommend stopping doing that because of people's recall being so unreliable. In terms of bus advertising, we always put QR codes that trigger the ad server on every bit of out of home that we do. And we have seen regularly in supermarket, on digital 6 sheets in streets, and bus advertising, 1 or 2 QR code clicks per placement, which is us testing it. Okay, so we know it works, then we put it out there, and there is 0 additional interaction with that. Now, do those things that you could argue they're not response mechanisms. What they do is they socialize and make the brand famous. Fine, prove it. Show me the cost per brand impression of that stuff. Can you prove it? They can't measure it. So on one side, we have something that is measurable, that works and drives outcomes. On the other side, we have something that is quite expensive and has no metrics data with it. It's hard to justify investing in it. If it is free, and if it is the council's owned, and, you know, in counties are probably going to become owners of out-of-home estates in the coming years, so knowing how to use them over the next couple of years is going to be really, really important. If it's free, no problem at all. But I wouldn't divert money away from search, remarketing, and online channels to that, because there is evidence of it not working, and there's no evidence of the value of the impact. And until that's available, and I would suggest that that's never going to be the case, leave it. I believe the reason back of bus advertising happens is because the organizations sell it to the public sector. The public sector is often the only people that buy it, and it's a habit. It's a habit of selling it to you, and it's a habit of you buying it, and that's all it is. We see it in fostering, we see it in other areas, and we see it doing nothing constantly. So don't invest, and try something else. Another way of looking at it, if you try the next quarter not doing any of that stuff and taking that money and putting it into things that work, do outcomes increase? If so, you know that you did the right thing.
Brilliant. Thanks, JP.
Thank
And yeah, for another discussion or webinar, I think, yeah, even if we set up a separate advert on each of the people's websites and then tested the comparison in terms of the click-throughs and engagement to those compared to busbacks, I think we'd know what the result was. Listen, we're going to bring that session to a close. Been really, really informative. Thank you to Russell. I've been looking forward to hearing about some of those smoking campaigns, as well as the insights that you brought from a behavioural change. Always really, really good to be reminded of some of those COM-B and EAST models, but done in a really engaging ways. Thank you also, JP, to bring some digital insights in terms of search and remarketing. Really fascinating. As I said at the start, we'll be sharing those slides as well as the recording of the session. Thanks for joining today, and have a good rest of the day. Take care.